This is GYRO, a self-stabilizing spoon designed to help individuals with Parkinson's eat independently. The IMU, or sensors, track hand rotation and movement, specifically pitch and roll, detecting tremors in real time. The data is sent to the ESP32 microcontroller, which acts as the brain of the system, computing adjustments and signaling the motors. The motors then adjust the spoon's position to keep it upright. This creates a continuous feedback loop. The IMU detects movement, the ESP32 processes it, and the motors adjust the spoon's position instantly. Right now, the spoon head is taped to one of the motor components, which works but isn't ideal. The handle is made from cardboard, and the internal hardware, including the IMU and motors, is exposed. The charging port is functional, but will need to be repositioned as the internal components are redistributed. Despite being in the early stages, GYRO already provides real-time tremor compensation, helping users regain independence and confidence. To reach high fidelity, we'll refine the feedback loop for faster, smoother response and greater variability beyond pitch and roll. We'll replace the taped spoon head with a 3D printed ball and socket. The cardboard handle will be replaced with a sleek PLA shell, with internal components integrated and protected by a silicone casing. The charging port will be repositioned for easier access, and a Velcro strap may be added for better grip. GYRO is already changing the way people with Parkinson's eat, and we're just getting started.
We just finished our makerspace interview. Let's go. What do you think?
Oh, I'm excited, man.
What do you think?
I'm pumped, man.
Yeah. Me
Super excited to get the project going.
Yeah, I'm excited.
Let's go.
I'm Zara, I'm the group project manager, and so far our project seems to be going great. I think the most challenging part of the project will be figuring out how to actually create the prototype and get it working. Ultimately, we need to consider what we're prioritizing in our product, whether that's price, functionality, or aesthetics.
Hey, Hudson Rothermill here. I'm mostly in charge of the financials as well as business model, and I think our team is crushing it. We're always very proactive, ahead of the game. I'm proud of us and excited to see it come to fruition.
Hi, I'm Rajiv, and for this project, I was the solution designer and the engineering consultant. So my role essentially was to design and develop our prototype. This ranged from doing the initial research into our components, ordering them, getting them, making a mock-up online, like a render of our product, and then finally putting it all together into our first initial prototype. And the goal here was to make a simple, reliable, and easy-to-use product. And I would say this whole experience was really incredibly rewarding, working with a team, and embedded projects are really some of my favorite things to do because it's the whole interfacing of hardware and software. But not just that, this product has the potential to really make an impact on people who don't have independence while eating, with Parkinson's and other diseases and other conditions. And so the fact that this has a really human impact really stuck with me.
Hello, I'm Ibrahim Al Mansour, and I'm the marketing liaison for GYRO. So I was in charge of looking into the market opportunity, and I was really surprised to see that over 1 million people in the US have Parkinson's. Also, I was in charge of interviewing a lot of people to see what they thought and to know how to market the product towards them.
My name is Michael. My role focused specifically on the go-to-market strategy and identifying the market opportunity. It was kind of a challenge and incredibly rewarding. For me, it was not just about launching a product, but it was also about delivering value to people who truly need it. Overall, I'm really proud of what we created, and I'm excited to see how GYRO can make a difference out in the world.
Hello, my name is Hudson Rothermill, and this is
Shreya.
Shreya, how difficult do you think it is eating with uncontrollable tremors?
I can imagine it would be pretty difficult.
Quite difficult.
Yeah, I would imagine pretty difficult. I already have a hand tremor. It's not nearly as significant as someone with Parkinson's would have, and that already makes eating difficult in sometimes. So I would imagine very difficult.
Yeah, much more difficult than if you didn't have.
I'm sure it's very difficult.
Pretty tough, especially an everyday thing.
I would agree with that. I feel like it would be pretty difficult for sure.
I would say a 10 out of 10 because that sounds very difficult, and I know someone that has tremors. Probably pretty challenging.
That's what I would say too, yeah.
And do you imagine a utensil that is self-stabilizing, helping others while eating?
I feel like that would be a useful tool.
I think it would be very helpful.
Absolutely, yeah. I mean, absolutely, if it helps the esteem issues of not being able to do a recurring daily thing, absolutely.
I agree. It definitely sounds like a good idea. I've never heard of anything like that.
That would be very helpful.
I think if my tremor got to the extent where it was necessary to have like an assistive device, I definitely would.
I don't know anyone with Parkinson's, but yeah, I guess if I did, I think I would be open to it.
Yeah, I agree with that.
Sounds like a great idea.
Yeah, I think I've seen like videos of it before and it looks like it helps.
Definitely be very helpful.
It would be useful.
Howdy, we're having one of our first team dilemmas when we are conflicted on what our pricing strategy should be. What do you think?
So I think it's supposed to be $100 to make it accessible to everyone, but we have people who disagree with me, so let's see.
I think it's too low because our competitors are a bit higher, and we still want to be lower than them, but like enough to sort of match.
So what would you suggest?
Maybe somewhere around 200, because our competitors are like 350.
All right. What do you think, Rajiv?
And I'm kind of like the fence here because like I'm thinking we can start high and then like as we scale we can go lower just like so we have the initial high margin for like R&D, that kind of stuff, and then after that make it more affordable.
I like it. Yeah.
What do you think, Hudson?
I'd say I would agree kind of with Zara. I think we should price maybe a little bit higher, but strategically lower than our competition, which they're around like 350. So I think the 200 range would make sense. So yeah.
Sounds good. Okay, so everyone, they're saying that they want to name the spoon Gyro, but I'm against it. I say we have to name it Helping Hand. So no one's agreeing with me. Why is that?
I don't know, I think the gyro's better name, man. It's just like, you know, the gyroscope and like the thing itself, and then also the food gyro, I think just, you know, most of the weaknesses.
I think Helping Hand is better.
No, helping hand is too generic.
But it's kind of creative. I'm a fan.
Yeah. What do you think, Michael?
I like that.
Okay.
It's different.
Okay, everyone, so our spoon, it's the first time that it works, and we'll see everyone's reaction to it. Wait. So, Michael, are you excited about the spoon?
Yeah, it looks very nice. It was well constructed.
I'm very proud of the team, especially Rajiv for his excellence in this field, and I think we're crushing it.
Okay, and what about you, Zara?
I thought it was really cool that it actually ended up working, and we didn't really have to spend too long on it, and it worked out fine.
Amazing, amazing. I'm so excited to show it to the class. So here's the mastermind behind most of it.
It took a while. All the parts came at different times thanks to Amazon, but it ended up working out. All the power junctions and stuff were great. Code works as intended, so we're good to go.
Amazing, amazing. GYRO becomes even more adaptive.
Counteracts their movements, their tremors, could combat this issue.
Come on, man.
Hands keep shaking. Food won't stay. Try to grab it, it slips away. Fork too light, grip too tight. Missed again, I lost the fight. Drops keep falling and stains appear. Every bite ends up unclear.
Today we're going to present to you our project GYRO. This is our team. I'm Zara, I'm the project manager.
I'm Rajiv, and I am the design and engineering lead for our team.
I'm Ibrahim Al Mansour, and I'm going to speak about the market opportunity.
My name is Hudson Rothermel, and my primary role for GYRO is finance and design.
I'm Michael, and I'll be doing customer research.
Before we go deeper, to quickly revisit our problem, Parkinson's tremors cause spills, frustration, and loss of independence while eating, especially with liquid foods. Current solutions are ineffective, expensive, being $350 or more, and bulky. Our solution to this is a compact, affordable, self-stabilizing spoon that counteracts tremors in 2 degrees for independent eating. In the bottom right is our prototype, made using Blender. The top image showcases our exterior. The handle is made to last a long time and is also thick for the purposes of being easy to grip for Parkinson's patients. Our bottom image is of the interior, showcasing two servos mounted to the joint with the ESP32, a rechargeable LiPo battery, and an IMU behind it. The key for assembly is streamlining it. More specifically, our solutions include tremor compensation backed by the ESP32, IMU, and dual servo, being lightweight and ergonomic with a non-slip matte PLA handle, rechargeable via our battery, which will have a 6 to 8 to 10 hour battery life and 500 plus charge cycles. The head is interchangeable, as I mentioned, and our goal is for it to be medical grade with FDA compliance as well as CE and FCC certifications. In the end, we aim for this to be $250 or below in terms of price with water resistance and impact testing.
I will talk about the acid test results. So first of all, we did the clinical relevance. GYRO is effective for mild and moderate tremors, and severe cases need faster or dynamic adjustments. And then for the usability, it's a textured weighted handle that improves the grip. A Velcro strap is helpful but hard to fasten, and the discreet design boosts confidence for the patients and the users. For durability, the ball and socket allows easy detach and wash. Water resistance is essential, and adoption, so it's easy to use with minimal training. Patient independence is improved and it makes caregiving easier. And for the refinement, it's more spoon head types and sizes, and we need to expand motion range beyond the pitch and roll, improve smoothness, and quicken the feedback loop.
Out of 59 total responses that we have collected, our field research has provided valuable insights into our GYRO product. We found strong recognition for its role in improving independent eating with a high interest in testing the product before purchase. When it comes to purchase intent, affordability and local availability emerge as key factors for our customers. Additionally, 65% of respondents preferred a sleeker, more discreet design, while there was also a demand for a lighter, thinner, and textured handle. Proof of effectiveness and expert endorsements were identified as important for gaining consumers' confidence in our product. As for refinements, over 70% of participants expressed a need for an expanded motion range better accommodated severe tremors. Interest in different handle sizes, colors, spoon heads was also significant in this case. Lastly, ensuring that the Velcro strap fit and usability was highlighted as a crucial aspect for improvement. These findings will help us make the necessary adjustments to enhance our GYRO product and better meet customers' needs.
Here's a quick overview of our initial financials based on a conservative estimate of selling 100 units. Each unit is priced at $250, bringing in $25,000 in revenue. Our cost of goods sold comes out to just under $40 per unit, totaling $3,826. This gives us an operating margin of $21,174. However, as a new business, we're facing significant startup costs and early investments, which total about $26,773 in operating expenses. That results in an initial pre-tax loss of $5,599. This early loss isn't unexpected. It reflects our upfront investment in infrastructure and our strategy of affordability to build market traction. Importantly, as we scale, we expect these expenses to become more efficient, pushing us towards profitability.
These are our references. These are our appendices, starting with the user journey map, which explains every step of the user experience, including hardware and software interaction. Here is our hardware specification sheet, including dimensions, BOM, materials list, and key design elements. Here is our software specification sheet, which includes wireframe, sources and uses of data, host and storage information, design elements of website and app. These are our acid test questions, our responses, our acid test participant profiles, the questions we asked in our survey for our field research, the responses for our survey, and this is our survey participant profiles, which were split into portions. There's also a provided rationale for each of these groups. Here's our cost of goods sold breakdown, which includes the BOM and cost to assemble and deliver the solution. Lastly, our operating expenses, which covers salaries, rent, utilities, computers, supplies, marketing, sales, insurance, and more.